Could you please explain what is a baseline fertility ultrasound?
Starting IVF treatment or before you see fertility specialist, your GP requests baseline fertility ultrasound scan. So depending on where you will have a scan and the level of expertise or specialization, so you may just end up having simple gynecological ultrasound scan, which says ovaries look normal, uterus looks normal, we can't see any pathology. So that's a very, very basic gynecological ultrasound. It's not fertility ultrasound. Fertility ultrasound should have a very specific type of systematic investigation. So in fertility ultrasound scan, generally we want to find out if there is any pathology. First, we want to find out if there is any pathology which can cause infertility first, any pathology which can cause problem with the creation of eggs and embryos, and any pathology which can affect your implantation in IVF, and also is there any pathology which can impact your pregnancy negatively. So that's much more systematic scan than gynecological scan. In gynecological pelvic ultrasound scan, essentially sonographer wants to find out if there is any cause of gynecological problems like heavy menstrual period, painful period, or any sign of endometriosis, ovarian cyst. That's a very basic scan. So in fertility scanning, in baseline fertility scanning, we have a minimum requirement. So minimum requirements are to diagnose any ovarian pathology like ovarian cyst or like chocolate cyst or dermoid cyst. So, and also we want to find out your antral follicle count. Any ultrasound scan which doesn't tell us antral follicle count is not fertility scan. That's just gynecological scan. So antral follicle count means the sonographer should measure all the follicles on your ovaries and count how many follicles you have less than 10 millimeters. That's antral follicle count. This is very critical information for fertility specialists because antral follicle count tells us about your egg reserve. It's same as AMH. So AFC, which is antral follicle count, has a very similar power in terms of diagnosing your ovarian reserve as AMH. So that's why if I see ultrasound scan which doesn't tell me antral follicle count, that's not fertility scan, that's just gynecological scan. So yes, an antral follicle count is measured and counted by measuring each and every single follicle on your ovaries on the right and left and adding a right and left antral follicle count together, which tells us your egg reserve. So, and also basic fertility scan should exclude hydrosalpinx. Why? Because hydrosalpinx may not be that significant in gynecology, but it's very significant in fertility investigation or treatment. Because if you have hydrosalpinx, that can reduce the chance of implantation. That we need to treat that hydrosalpinx before doing embryo transfer. So then also fertility ultrasound scan gives us a very good information about the uterus, uterine size, uterine texture, like whether it's homogeneous or heterogeneous uterus, which can actually tell us whether you may have adenomyosis or not. And also it should tell us whether there's any abnormality in the uterus, like Mullerian abnormalities like arcuate uterus, bicornuate uterus, or septate uterus. And also it should tell us about endometrium. Is there any polyp inside the endometrium? And also endometrial thickness according to your menstrual cycle. Let us say if you're doing scan in the mid-cycle, your endometrial thickness should be more than 7 millimeters. And also should tell us whether there's any fluid inside the endometrium. So these are the minimum requirements for baseline ultrasound scan. On the basis of that, then we can try and understand what could be the cause of infertility and make a planning for fertility treatment, including for IVF treatment.